So today's topic is careers in mental health and counseling for child development majors specifically. There we go. So sorry, 1 second, technical problems. Oh, there we go. It all started moving at once. And so first off, we'll have a presentation by Dr. Brianne Ford, who is an assistant professor in the Child and Family Studies Department. And then we'll have a Q&A and a little mini interview with one of our alumni from the Child and Family Studies Department who's currently working in the field. So Dr. Ford, as I mentioned, is an assistant professor in Child and Family Studies. And Dr. Ford, you began in the department in 2020, is that correct? Or 2019?
2021, technically, but in January of 2021.
Okay, great. So you might have had classes with Dr. Ford already, and she's a licensed clinical psychologist, and she's going to walk us through what the fields are like, what you can expect from mental health careers, and I'll go ahead and turn that over to her now.
Great, excellent. And I will pull up my slides. All right, cool. Everybody see that okay? Great, excellent. Wonderful. So yeah, so like Dr. Munger was saying, I'll give you a little bit of background. If you guys have had class with me, this is stuff you've probably heard like 20 times, but I'll give you a little bit of background on who I am and what I do and how I got into this field, and then give you a little bit of background on different ideas for careers in mental health and counseling. I know that next month you guys have a presentation related to careers in social work. There's a lot of overlap. So I'm going to talk a little bit about that, but then probably get into much more detail in that next talk that y'all have. But just a little bit of background on who I am. Dr. Ford, Bree, assistant professor in the department. I teach classes in child abuse and family violence, and grief and loss. And then also I teach a master's class called Child Development in Global Context that's really specifically focused on working with immigrant youth and families, and especially in a trauma-informed way. My background is as a clinical child psychologist. And so I'm a licensed clinical psychologist. And so what that means, my specialty is in assessing and treating trauma, especially what we call complex trauma. So trauma that is the result of child neglect, child sexual abuse, child physical abuse, things that kind of go on for a long time during childhood. And so that the process of providing therapy for that can look a little different and a little bit more intense. So that's kind of what my specialty area is. I've also worked a lot with depression, major depression, especially in teens, anxiety disorders in teens, and also a lot of crisis behaviors. So things like cutting or suicidality, a little bit in eating disorders, that kind of stuff. So specialty really with kids and adolescents, but you end up working with the whole family, as you guys definitely know from your classes. Now, because I'm not yet licensed in California, and I can talk about why that is if you want to know later, but I'm still licensed in Colorado, where I used to live. I primarily provide psychological evaluations for individuals who are detained in immigration detention centers. And I do that for both the state of Colorado and the state of Idaho, because Idaho has so few psychologists who speak Spanish that they have these looser licensing laws where people can come in and do telehealth if they're licensed in California, New York, or Texas, which are the hardest places to get licensed. And I primarily work with Spanish-speaking clients. There's a huge need for this in social work and in psychology. So those of you that speak Spanish just know that that's a huge need. And a lot of times California is really good about providing something called a bilingual differential, where you get like 1.15, like for every hour of work, you're paid at 1.15 the amount of someone who is not bilingual. So they recognize that there's additional work there, and they pay you a bit more if you're bilingual. And that's not just for Spanish, that's for other languages that are needed. My research is really focused on trying to increase access to mental health services. So a lot of people, don't access services for a number of reasons, but one of them is stigma. feeling like this is not helpful for them, that, you know, they don't need to go to a psychologist, like crazy people go to psychologists, things like that. So some of my work is actually training nurses, mothers, other people to provide mental health services that aren't mental health professionals. And that's primarily in Peru and in Guatemala, but it's something that I'm looking to do a bit more here in the US as well. So that's a little bit about my background. We'll dig in more into like how I got to that path, because I think it's a helpful thing to look at and thinking about, okay, you know, how do you know what you want to do, or how do you get to that space? So we'll go through that as well. But I wanted to start because I think we throw around a lot of these terms. I wanted to start by just kind of digging into what some of these terms mean. Like when we think about the word mental health, you know, I think so often, especially now since the pandemic, people are always talking about, I need to think about my mental health and what's best for me and all that kind of thing. So I wanted to make sure we have like a good grounding of what that term means. Mental health includes our emotional, psychological, and our social well-being. One of the things that I think people realized a lot in the pandemic is how much that social isolation, or not being able to visit family or see friends, how much that impacted their feelings and behaviors, right? So it's not just your individual well-being, but also socially, how connected are you? Our mental health affects how we think, how we feel, how we act, how we can handle stress, relate to others, whether or not we can make healthy choices. Mental health is important at every stage of life: childhood, adolescence, adulthood, right into older adulthood. The terms mental health and mental illness are sometimes used interchangeably, but they really shouldn't be. It's kind of, if we could just kind of put that word physical there, physical health and physical illness, it's not the same thing. A person can experience poor mental health or be struggling with their mental health and not be diagnosed with a mental illness. I really like this image on the right because it shows how our mental health, just like physical health, is really on a spectrum. There might be periods of life or times in the semester when someone feels like they're just surviving, right? They don't feel like they're at an optimal level of mental health. Other times they might feel like they're really struggling. When we get into the crisis zone is usually when we think, might there be a diagnosable illness going on, or might there be a space where someone needs more support, needs something like therapy, a support group, something like that, right? When we're in kind of our struggling or in crisis zone. But a lot of people also seek therapy to maintain. So if they get to a place where they're surviving or they're thriving, they stay in therapy as a process of kind of trying to stay at that level. So you can work with people at different levels of this spectrum. So that's kind of what we mean by mental health. Please stop me if none of this makes sense or if you have a question. When we talk about mental illness, that's a little bit different. Mental illness is a diagnosable condition. Again, affects mood, thinking, and behavior. If you look at that little like purple image on the right, I like that one because it kind of shows, all right, this is, you know, maybe you have all these thoughts in your head at night and you just can't turn your brain off and you're thinking, and you're so worried. And then, you know, maybe you feel so sad that you can't get out of bed, or maybe you get so angry that you end up kind of breaking things. Like there's this idea of it starts to affect your thoughts, your feelings, and your behaviors to a level that causes significant impairment in daily life. The difference between maybe poor mental health and mental illness is how it impacts someone's functioning. There can be people who are struggling or just surviving, right? But they can still make it to classes, they can still go to work, you know, they still have decent relationships with their friends. It's not optimal, but it's okay. Versus when we see these disorders, there's a real impairment in functioning. You guys have probably seen, I put a couple examples of like what are diagnosable mental illnesses. You guys probably have heard a lot of these before. Any of you guys have taken an intro psych class have learned these before, but you can work in kind of different areas, or you can be someone who specializes in kind of like a generalist model of just kind of seeing any of them. So there's things like major depression, anxiety disorders, things like ADHD or autism spectrum disorder, PTSD, and then there's things that are more severe like psychotic disorders, things like schizophrenia. So there's a real range of kind of different mental illnesses. In terms of what is the most common, well, 1 in 5 adults in the US experiences mental illness in any given year. So that's a lot. And when we look at teens, especially, young, children and teens especially, 1 in 6 teens will have a mental illness at some point during their teenage years, a diagnosable mental illness. That doesn't mean they will have it their whole life. Some people have a really severe episode of depression as a teen and then get good treatment and they actually don't have a reoccurrence. It increases the chances, but it doesn't mean that they definitely will. The most common disorders are anxiety disorders, followed by depression. Anxiety and depression are our big ones. That's why there's so much research that goes into anxiety and depression. That's why everyone who goes through any of the career paths I'm going to talk about learns how to treat, recognize, manage anxiety and depression, because they are the most common conditions. And a lot of times they go together. A lot of people can have both, right? And then we see things like substance use disorders, bipolar disorder, schizophrenia, eating disorders, and things like PTSD or trauma. With those, people tend to specialize. So for example, I am not trained as a substance abuse clinician, and I probably wouldn't feel super comfortable. I feel like I would feel comfortable working with adolescents with substance abuse problems because I see it as a crisis behavior a little bit more, but that's not my area of specialty. So once you get past like some of the more specifics, people tend to specialize in those areas. So that's kind of just an overview of what we mean by mental health and mental illness, so that you can kind of see, based on what the different careers are, what are they really working with? I know you guys probably won't ask questions, but just in case, are there any questions up until this point? Because I'm going to go into what some of the career options are, but any questions about those distinctions? Okay, well, let me know, and I'll go ahead and kind of talk to you about what some of the ways are you can work in this field. The goal of mental health care is to basically improve mental health. That's the goal, and to manage or treat symptoms of mental illness. So you have some people that don't necessarily think about or need diagnoses, that they really are just more focused on helping someone function at a higher level, live a life that feels more ideal or optimal for them. And then you have others that are very specifically working on, a certain type of mental illness. Especially people that work with psychosis and schizophrenia, they tend to specialize in that because it's so different, than perhaps depression, right? If you want to work in this area, what's really cool is that there's so many different options. There's so many different paths that people can take if they want to work in the mental health field. In terms of like what this could look like, people think a lot about therapy, but that's actually just kind of one part of mental health. So therapy is one thing, but it can be individual therapy, it can be family therapy, it can be group therapy. Group therapy, those of you who have taken the grief and loss class with me or with anyone else, know that group therapy is actually one of the best modalities for things like dealing with grief and loss. It's also one of the best modalities for people who lost someone to suicide, right? Things where there's a lot of stigma to them, these group treatments. Treatment for substance abuse, best treatment is group treatment, because people can kind of see themselves in others. They can recognize that they're not, that they're not damaged, that there's other people who have this too. And having that sense of identification and support is so important. So that's one thing that can be, if you're like, well, I've always really thought about teaching. Well, delivering group mental health interventions has a lot of those same pieces, and is just like a really helpful thing that people can do. There's also different types within that, right? So if we think about individual therapy, well, I have a friend, for example, in Colorado who does individual play therapy. And that's like what she does all day long. She does play therapy with kids. And a lot of times those are kids that have experienced trauma, and that, just like we tend to process verbally, we know kids process through play. So it's a type of play that's structured in a way that kids can process what they've been through. There's people who get their degree in music therapy or in art therapy. So there's lots of different kind of modalities within that. Assessment and evaluation is another thing. This is a little bit more common at the kind of psychologist level versus the counselor or therapist level, but this is another thing that you can do. And sorry, my little one is here with the babysitter, so she might be screaming. So yeah, there you go. We'll see what happens. Hold on, I'm gonna let the dog out so that she sees the dog and gets happy. All right, let's see if she calms down. So assessment and evaluation, these can be things like I do, which is psychological evaluation. Actually, is it really loud? Her screaming? No, okay. Let me know, guys, if the crying and screaming gets too loud. You can also do things like another degree that I think is really useful for people to think about who are also have their background in child development is a school psychology degree, because this combines a lot of what you're doing with your child development stuff with mental health. You work within the schools, you do a lot of testing, like testing to see if people have learning disabilities, or to see if they have, severe emotional or behavioral needs. But then you also do things like leading groups. You can lead a group if there's, a grief experience, you can lead a grief group. You go and you train teachers and kind of how to, teach in a way that helps kids with their emotions, things like that. And it's a really varied job. If there's a crisis in the school, if there's a tragedy, you help provide services, but you also help, again, train the teachers, train administrators and what they can do to support mental health. So there's a lot of cool different things you can do in that area. And then again, another like thing that mental health professionals can do is training and consultation, whether that be teacher training, parent training, training of other professionals. There's lots of stuff that can fit into that, as well as research. So that's like just what that can look like. It can be a very varied job. When we think about the different actual paths, these are just some different terms that you may have heard. This basically goes in order in terms of the amount of schooling needed to get to this area. Therapist and social worker are typically about the same. Social work can sometimes be a little bit longer, but they're usually about the same. But counselor, we can think of someone like a drug and alcohol counselor. That sometimes can be just 1 year of school, whereas being a licensed professional therapist or a marriage and family therapist can be more like 2 to 3 years. Social worker, again, probably 2 to 3 years. If you want it, you can get your PhD in social work, and then we're looking at more time. Psychologist is typically minimum 5, and usually max about 7. And then psychiatrist, because you have med school as well, that's more like 9. So just know that as we move down this term list, we're looking at more years of education. And I'm going to go into that in more detail for kind of the social work psychology part. There's, as you guys will see when you have that other talk about careers in social work, there is a decent amount of overlap between social work and psychologist. One of the things I think is helpful for kind of differentiating, psychologists do tend to focus on a little bit more on disorders, on this idea of like, what are the symptoms of an individual? Social work tends to see it more as like, what is the system, what is the larger system doing to that individual to cause that? So rather than focusing so much on, genes and what's going on like biologically and all that kind of stuff, they're saying what's going on in our society, what's going on in this community, what's going on kind of this larger structural level that's leading to someone's distress. And so they might focus more on the impact of discrimination and how that impacts someone's well-being versus saying, what genes are involved in this. Again, a lot of overlap. A lot of psychologists would say, oh, I think about that too. And there is more and more push for psychology to think more about these larger social justice principles, but social work just does that at a minimum. That is like how they function, is they're always thinking about this larger idea of justice and structural violence and that kind of stuff and how that impacts. So if that's something that appeals to you, that's, I think, a really good road. Again, psychology does it too, but social work, I think, does it a little bit better, in all honesty, because that's kind of where they grew from, was this idea of understanding how systems impact individuals. So that's one of the distinctions. Social work is kind of known as they starting in the child welfare space, right, of protecting children. And that is still something that they do, but it doesn't look the same as it used to. They're now involved in a lot more kind of what we would think of as like therapy as well. So typically, if you want to work in the field of mental health, there's 3 paths: the counseling and therapy path, the psychology path, and the social work path. There's a lot of information on this slides, but I just want to show you examples. The counseling and therapy path is usually master's level. And there's a couple different degrees here. And Dr. Munger, please jump in if you want to explain MFT better than I do. But a mental health counselor or a licensed professional counselor, this is not common everywhere. This was really common in Colorado, but in talking to some students here, it seems like it's not as common in California. This degree, it's very similar to an LCSW or a licensed clinical social worker. So it's someone who's learning therapy, but probably is learning therapy not to work with things like severe mental illness, not to work with, let's say, bipolar, schizophrenia, psychosis. They're learning much more about managing depression, anxiety, trauma, because everyone has to learn how to manage trauma. It's so common. But that's more of a master's level degree. A marriage and family therapist is getting very similar training, but the focus is really thinking about family systems, right? And thinking about, again, marriage, like how do we do things like couples counseling, and how does a person function within a system? And how do we address, that aspect as well? So marriage and family therapists are really thinking about that larger family system. You can still get training in that kind of stuff if you go in a more general degree, but MFT, again, is doing that as like the basis. Play therapist, again, some similar training, but they learn how to utilize play to express their feelings more easily through toys instead of words. School counselors, so school counselor and school psychologist is an important distinction. School counselor is a professional, they can work in primary schools, secondary schools, but they are providing academic and career advice as well as social emotional competencies. So these might be people who, yes, are doing programs that have to do with like drug and alcohol prevention, but they're also helping you figure out what college to apply to. So that's a very different kind of career, school counseling, than school psychology, which is much more focused on kind of like the psychological and socio-emotional aspect. And then, as I mentioned, drug and alcohol abuse counselor, because there's such an extreme need for these, it's actually a faster degree often. Sometimes this can be just a year-long degree. And you learn specifically how to work with individuals, families, couples, and groups for managing the use of unhealthy substance use. So these are kind of those paths. Dr. Munger, do you want to add anything for any of those?
No, that was a really excellent summary. And I think one thing I would say is just that play therapy, you can also get certified in from a variety of fields. Like when I was in MFT, I got a certificate in play therapy.
Yeah. Most for play therapists, typically the person is like also mental health counselor, also MFT, also psychologist. Like you have your degree in something general, and then you can get a certification as a play therapist. Yeah, exactly. That's a great point. So it's not usually a standalone degree, play therapy. It's usually something that's kind of added on. But I think it's a really important thing for especially child development people to think about. You can do play therapy certifications that are specific to working with hospitalized children, people who are interested in child life. There's a whole nother side of that kind of work that can be more of the mental health kind of path. So it's kind of an interesting thing to think about. I kind of mentioned this already, and I want to make sure I don't take up too much time, but just in terms of how much more school this is, typically this kind of master's level, you're looking at about 2 to 3 years. It depends on, some programs allow you to do part-time. So some people will do a part-time program and work at the same time, but typically about 2 to 3 years. It includes field work. So most of the time you're doing like practicum experiences, externships, whatever every program calls them something different at the same time. So you're learning clinical skills as you're going to school. Sometimes that starts in year 1, sometimes that's during year 2. And then typically you do a year of supervised experience after. It's not that it's specifically a year, it's the number of hours, but usually if you work full time, it amounts to about a year. California tends to have the strictest licensing requirements, so it could be a little bit longer in California. I know for psychology, you end up needing about 2 years of field work afterwards to get to the number of hours you need for California. But it's typically about that amount of time. And then you do what's called sitting for a licensing exam, right? And then you'll usually also take an exam that's specific to each state. What are the laws of each state around things like age of consent, reporting laws, things like that. So in total, you're looking at like 3 to 5 years, but you're looking at about 2 years where you're not getting paid, right? And then usually when you start into that field work, you are getting paid. It's lower while you're being supervised, and then it'll bump up. So that's kind of what you're looking at. I'm not going to go through these, but I did put, because I'll send these slides along, I did put like an example of what I know like a job could look like, just so you guys can get an idea of what that would be. What I forgot to put was the pay. This one said like 68 to 72 starting salary. And this is someone could be a licensed professional counselor or a licensed clinical social worker. So it could go with either of those paths, but just so you can get an idea. And this is one that's school-based, as I mentioned. So after the counseling path, we have the psychology path. These are doctoral level degrees, and there's more than 3, but there's 3 main options: a school psychology, which can be an educational doctorate or a PhD, counseling psychology, and clinical psychology. This is 5 to 7 years of education after undergrad. It's usually 3 to 4 years of coursework and then a year-long clinical internship. Most states also require postdoctoral training before licensure. So California, as I mentioned, requires 2 years. But there's states that have a shortage of mental health professionals like Nevada or New Mexico, where there's no postdoc required. So it depends a little bit on where, if you're like, I'm going to stay in California, you're looking at 2 years after the degree for sure. The differentiation, again, school psychology is, I think, a really good fit for child development majors. There's also a huge need for school psychologists right now because the generation of school psychologists is like my mom's age and they're all retiring. So there's like a huge gap in this. And now more and more schools are realizing, it used to be like one school psychologist could work like maybe 1 day a week at this school, 2 days a week at this school. But now more and more schools are like, we want someone full time. So there's more and more of these jobs. And with this, you're applying your expertise in mental health, as well as learning and behavior to help children succeed academically, socially, behaviorally, emotionally. It's a really interesting job. I have a good friend who's a school psychologist and just absolutely loves it. And you're on like the academic calendar, which is nice because you still get like those summer breaks, right? You do a mix of kind of assessment, support, and intervention. You work a lot with families and with teachers. The pay is pretty good typically for school psychologists. So you're looking at like maybe 10,000 more a year starting than those social work jobs. But it kind of depends again on where you decide to work, of what that would look like. Counseling, this started for providing individuals who could work at counseling centers at college campuses. So if any of you guys were to go to get counseling services at Cal State, you'd probably be seeing someone who has their background in counseling psychology. And these are individuals that really are focused less on diagnosis and more on just the stressors of daily life, the issues that we all deal with, and how do we manage those. Counseling psych pulls in from social work in terms of thinking about the impact of systems and discrimination and the role of, what does it mean to be from my identity group? And there's a lot of exploration of those issues, which I think can be really helpful. And again, they usually work at universities or school counseling centers. And then the last, which is my background, which is clinical psych degree, we're trained in diagnosis, intervention, treatment, and we really focus on mental illnesses a little bit more. So we're saying, okay, what is the diagnosis here? And then what kind of treatment do they need? A lot of times we're partnering with psychiatrists to make sure that people can access their medication, but we tend to work with more severe diagnoses than maybe the counseling degree. So that's the psychology path. I know probably about out of time. I have some information here on the social work path, but you definitely will get more of this in your talk, I think, next month. But there's just some information here. The one I would point out is the licensed clinical social worker, because this is the one that has the most overlap with just the counseling kind of path in general, because you're thinking about all these aspects like community resources and, monitoring vulnerable populations, providing social services, but you're also providing psychotherapy. So I work with a lot of students who have their LCSW and they might have a private practice or they work providing therapy all day long. So this is a similar path. The social work program at Cal State can basically set you up to get an LCSW, a licensed clinical social work degree. And then school social work is another one to think about, but you'll probably learn more about that later. So just to wrap up, my path was, I had my undergrad in psychology. I did a minor in Spanish, and then did my PhD program in clinical psych. And I got a specialization in this very kind of generic children, families, and cultures. I think it's such a funny name because it's like, okay, so everybody basically. With the PhD program, you do have a thesis and dissertation requirement. So you're going to do some research. And typically people pursue a PhD because they want to do some research or they want to do teaching, right? So that's part of that aspect. And then you do different clinical experiences along the way. So I did some work in pediatric psychology, community mental health, school-based work, neuropsychology. You get to explore a lot of different things along the way to see what path fits best for you. I did my internship at the University of New Mexico at a children's inpatient facility. So kids that had a suicide attempt or severe crisis behaviors. And that was like an intensive experience. And then I would follow them when they went into intensive outpatient. And then I did my postdoc in something called pediatric psychology. And I worked with kids that were getting bone marrow transplants and were going to be hospitalized for 6 months to a year. in managing their mental health. Because as you can imagine, the mental health impact of that was pretty significant. So I left a slide on here for you guys that you can take a look at this website. The website explains it better than I do, for sure, but I just wanted to make sure you had this information of what is available at Cal State. If you were like, okay, I'm interested, can I stay here? Yeah, you can stay here. You can stay where you are. There's the school-based family counseling program, which you then can get a master's in family, a master's in marriage and family therapy, or an LPC. But also gets you ready to work in school settings. There's the master's in applied behavioral analysis. So those of you, maybe who have worked with kids on the autism spectrum disorder, this is a huge need. There's also a master's option in rehabilitation counseling to help people that live, that are living with different types of disabilities. And then there's a school psychology program as well. So I'll put a link to the website when I send along these slides, but that they have a lot more information on these different options. There's a lot of great options here at Cal State LA. So that's a lot of information. I'll be sure to share my slides because I know it's a ton of stuff. If you're interested in learning more, I'm so happy to chat about it. You can just email me and we can find a time to talk in more detail. And sorry for going over my time, but those are some careers in mental health.
Awesome. Thank you so much, Dr. Kaur. We really appreciate it. Does anybody have any quick questions for Dr. Kaur? And in case anybody's typing, in the meantime, I loved Dr. Kaur. Thank you so much for sharing the different kind of philosophies and focuses of the different fields. That's super useful in terms of folks identifying which fields resonate most with them. And then also, if you're going to apply to a bunch of different types of programs, making sure that your applications are tailored toward the focus and philosophies of different fields is really important and will help you to stand out in your applications and help it to kind of be more resonant with the folks that you're sending your applications to.
Yeah, that's an excellent point. Jumping on a quick Google search before you actually write of what's the difference again between counseling and clinical, what is the school psychology philosophy? Because they are different ways they might work with the same people, but they have different ways of understanding what causes distress and how you manage and treat distress. And so having an idea of that is super important. It's a great point.
Yeah. Thank you so much for going over that. And then the other thing that kind of stuck out to me is you're talking about licensing, and we were actually just chatting for a second right before everybody got on, and going into a program in the same state that you plan on getting licensed will make your life a lot easier.
Yes, absolutely.
Because licenses don't necessarily go across states. So it might be in some cases where it's pretty easy to go from one state to another, but in a lot of cases, especially if the standards are very different, it'll be a lot of extra work to go from being licensed in one state to being licensed in another state.
Yeah, exactly. Yeah, I was licensed originally in Georgia and then was able to transfer my license pretty easily to Colorado. I had to take just kind of a exam that looked at different laws in the state, right? But in California, if I want to get my license here, which I do, I have to take 6 more courses before I can do that. And I already have, 6 additional years of education. So, there is,
and a full-time job.
And if you get licensed in California, that's the best because that's the hardest. And so then you're kind of good wherever you go.
Although, anyway, we'll go back to that. I think we have Jennifer first, and then we'll go to Sandra. So Jennifer, what's your question? Oh, sorry, Jennifer, you're on mute. Oh, Sandra? Do you have a question?
Yes, I don't have a question, but I just wanted to say that all the slides really helped me. I didn't really know what I was kind of coming into, but I found it really interesting. All the licenses you could get depending on what you do. I found that really interesting. Like I said, I didn't really know, but coming into this, it was so detailed and it had so much details. I actually screenshotted a lot of the slides so I could remember. But yeah, I found it very interesting and very like it was a lot of examples which I really liked, and I like seeing everything written down because it gave me
Yeah.
like, I'm a very like image coordinated person. Like if I have to see something to like really understand it, and seeing everything helped me a lot. So thank you.
Yeah, of course. And I think that, again, I'll send these slides out because I do think it's something where you can hear it and you're like, wait, what's the difference? So that way you can have it to look at later. And I think the best thing too is to find people that do that job, find someone in that field, because they can give you an idea of, okay, what does your day-to-day look like? Because every job, every path, there's so many job options. And so I think it's helpful to meet people that have taken different paths and understand what that looks like on a day-to-day basis. So, but thank you for your comments, Sandra.
Awesome. Well, thank you so much, Dr. Ford. Really appreciate your time. And we hope you have a good rest of your day.
Yeah, I don't see it if my child's still screaming. So thank you guys so much. And please feel free to shoot me an email if you have other questions.
Thank you.
Thank you.
Awesome. Okay, so now we're going to move to our next presenter, who is an alumni of the Cal State LA Child and Family Studies program, Cesar Mejia. And he is an LCSW, and he got his LCSW from USC. Is that correct, Cesar?
I got my MSW at USC.
Yes,
Yeah,
awesome.
I could talk a little bit about that and the
Oh
difference.
yeah, that would be fantastic. Well, we'll just go ahead and jump right in, because I think a little bit of the background that's here is actually going to be in the first question. So thank you so much for coming and being so generous with your time. We really appreciate you coming and talking a little bit about your life and your experience with us. So the first question is, could you describe the organization you currently work for, and what's your role there?
Sure. First off, good evening, everybody. Thank you guys so much for having me. I always enjoy when I get these opportunities to kind of just give back and do something that I didn't get to do, when I was a student at Cal State LA. Probably was offered, but I just didn't really, head was in the clouds a little bit. But with that being said, I work for St. Joseph Center, not to be confused with St. Joseph's, like Providence hospitals. You can just simple Google search, you'll find stjosephcenter.org. It's a nonprofit organization based primarily out of the West Side, so Venice, Santa Monica, but in more recent years has expanded to South LA, and little bit like in the Culver City, now starting to go into downtown a little bit. So organization is about 300 to 400 people. So, it's kind of in the middle. In my current role, I am a director of mental health. There's 3 of us for the whole agency. And in this role, I oversee 5 different programs, 3 of which are with the re-entry population. So people, folks with history of jail, prison, and coming straight out of jail to some of our programs, as well as a Department of Mental Health contracted mental health program for people in supportive housing, and 2 programs in Santa Monica / Culver City that help the lower income folks in those cities maintain their housing.
Thanks so much for sharing. Our next question, if my computer is having a little bit of trouble with PowerPoint right now, I'm so sorry. There we go. So, and this one's a little bit more involved, and it's kind of a choose your own adventure. So if you wouldn't mind telling us a little bit about your path to your current role, and that could be things like your own background, the inspiration or mentorship or experiences, education or jobs that you've had, whatever you feel like is relevant for your background and path.
Yeah, of course. Well, I major in child development at Cal State LA. I kind of half jokingly, half not jokingly say, when I was determining what I wanted to major in, I was looking at the path with the least math possible. But in all seriousness, like I knew I wanted to do something with people. I just didn't know what it was. But I felt that, that child development, learning things from, from the beginning of life, like I felt like it would give me a solid foundation to eventually figure out what I wanted to do. And during my last year there, last quarter, I should say, I'm not sure if you all still have to do like the internship at the Anna Bing Arnold Center, but I had a intern with preschoolers, and while I love preschoolers, I have my own 3-year-old. I realized that wasn't for me. So I kind of did some more digging and asking around as to what I could do next. And yeah, like I said, I graduated in 2013. I originally wanted to go into occupational therapy. So I took about a year in between going to ELAC actually to take some prerequisites that I didn't, get during my time at Cal State LA for that specific program. And unfortunately, I didn't get into any of the schools I applied to. I was pretty bummed. But I knew I still wanted to do something with people. And then my sister-in-law was actually, it was her first year in the MSW program at USC. And she was just kind of, just through conversation, she was telling me a little bit about what she was doing in school, what she was doing in her internships, how she was doing therapy with students and young people. And, I grew up in East LA. So whenever I would hear social work, like many of us do who grew up in that area and in lower income areas, we think the folks that come knock on the door to take kids away. So once she, provided me with some resources, and I did my own research into how broad the social work program and profession is, I said, this is for me. I want to give this, this is what I want to do. And yeah, I applied and I got in. I did my 2 years at USC. If it would have been more of a better planning on my side, I would have probably applied to Cal State LA and saved myself a whole lot of money. But nonetheless, I'm grateful for the education I got there. I see something is about inspiration and mentorship. I can speak a little bit about both. Inspiration, one of the things where I realized I wanted to do more was while I was finishing up my time at Cal State LA, I was actually a after-school sports coach for Beyond the Bell. I'm not sure if any of you, have heard of that organization. But yeah, cool little part-time job to some supplemental income while I finished school. And, I would see kids. Sandra, you work there. That's awesome. I love Beyond the Bell. If I could, I would still be doing it today. I realized, through sports and coaching, there was only so much I can do to help these kids, and ultimately the families. I would see them, try to sneak home lunch in their backpacks because they didn't have anything to eat at home. Show up the next day wearing the clothes they were wearing the day before. Because their parents just didn't have the resources to get them, more clothes. And that's what kind of, was that trigger for me, like, okay, like I can be doing more than what I'm doing right now. And mentorship, my second year internship coordinator at during my time at USC, his name is Julio Ramos, and he is a director of family services at All People's Community Center. If any of you, live or drive by the South LA area, probably know which place I'm talking about. And he was the supervisor my second year of internship at USC. And I just felt like he was amazing. He was amazing to me. He was real with me, and just to also see another male in the field, it's something that's not that common. But yeah, he is definitely a mentor to me. I keep in touch with him to this day, 5 years later. And even in my role now as a director, where I'm trusted and responsible for making some pretty pretty key decisions at my agency, I still from time to time, you know, reach out to him. It's like, hey, Julio, what are your thoughts on this? Or even in my personal life, you know, if I'm thinking about doing something, getting a new car, and he just kind of does the old therapy trick back to me. Well, what do you think? What are your thoughts about it? But yes, I am super big on mentorship. And I think like Dr. Court had mentioned, I think that's something that's super key to helping you get to where you want to go, is finding somebody in that field who will just be real with you. You know, one of the things I really appreciate about Julio was that he had already started having discussions with me about, you know, salary and how to negotiate salary and knowing your value as an employee. And I don't necessarily think that is taught in school sometimes. You know, school is a lot more about theory and skills that you're going to use, you know, in the profession. But your value as an employee is something that, you know, is going to keep you there. It's going to help you feel fulfilled in your personal life. So I'm glad that he, you know, had those conversations with me. And that's something that I make sure to emphasize with my newer hires, you know, people that just graduated school that are super like, you know, bright-eyed, bushy-tailed, ready to just tackle the world. Like, hey, you guys, you know, let's talk about how you're going to make this last, because this feeling of saving the world is not going to last forever. And my jobs, I've actually been fortunate enough to be at St. Joseph Center for the 5 years since I graduated from USC. I actually started there. I applied for the wrong job. Actually, before I go there, I did take a month off to travel before I started searching. You know, I graduated in May 2017, and I traveled with my girlfriend, now fiance, to Southeast Asia for a month. And we hit about 5 countries. And I remember I was very ambivalent about going. You know, I was like, well, I gotta get a job, I need to make money. And Julio, actually, my former supervisor / mentor, was like, called me Cesar, you know, he had a Hispanic accent. He's like, Cesar, you're gonna be working the rest of your life. Like you're literally gonna work the rest of your life. And once you start working, at the max, maybe you can take 2 weeks off at a time. You know, so I would recommend that you take this trip, enjoy yourself, celebrate, you know, all that you accomplished, refresh yourself, and then come back and, you know, really hit the ground running. And I cannot thank him enough for giving me that guidance, because he was right. I haven't had more than 2 weeks off since I started working. And I'm sure Dr. Munger, as all her years of practicing, she probably hasn't had more than 2 years, 2 years off, at least that she wanted to take for vacation. Yeah, so I took that month off, traveled, came back refreshed. And I had a friend at the time who was working for St. Joseph Center. And in my head, I thought St. Joseph Center was just like a store, you know, like just somewhere you walk in and there's just one place with one program. So yeah, I applied for the first job I saw on the website. I applied for the wrong job. I was late to my first interview ever in my professional life. And about 10 minutes into the interview, we both realized, me and the supervisor at the time, that I was in the wrong interview for the wrong program. But she was like, hey, like you're already out here in Venice, like you just want to interview anyway since you're already out here. And I was like, yeah, sure, whatever. And it ended up being for a street outreach team. So it was a frontline therapist for a street outreach team, working hybrid, like, so actually going up to folks that are visibly on the street, homeless, you know, to try to link them to mental health services, splitting my time doing that, and also at our bridge housing. So we had a contract with Department of Health at a boarding care in Santa Monica, where we would, you know, encounter somebody on the street, like, hey, what if I told you just have to answer a couple of questions and I can help you get indoors today? And ultimately in about 6 months to a year, if, you know, you get linked to some meds, you know, do some routine work, go to groups, we can get you your own apartment. So I did that for about 2 years. And it was like, I really enjoyed it. It was an interdisciplinary team, meaning it wasn't just me. There was six positions, I'll say, because, you know, people come and go. But in addition to me, being the mental health person, there was also a substance abuse counselor who I actually still keep in touch with today, and he helps me get my people into treatment. There was also a registered nurse, who would provide street medicine on the streets of Venice. There was also a case manager to help with, people getting their documents, housing, all of that. And there was what is called a peer specialist. So somebody with lived experience, who can kind of emphasize like, hey, I was in your shoes once, and these people helped me, like, let me help you. And yeah, I did that for about 2 years, and then life kind of happens. And I had to get a job a little closer to home, and the timing was perfect. And a new office and new job opened up in downtown LA, which was about 12 minutes away from my parents' house where I was living at the time. Before that, my commute to Venice, mind you guys, I had to be in Venice at 7 a.m. and I'm commuting from East LA. So I was catching traffic going and coming home. So that commute both ways was about 3 hours per day. And like I said, when it was just me, it was manageable. Like I said, life happens, AKA my fiance was pregnant, and I just couldn't fathom the idea of being in traffic for 3 hours a day and then coming home to a toddler that needs all my attention. And I will also put that into your ears and your thoughts now, you guys. Quality of life is super important. It's great if you're going to be making a lot of money, but if you're going to come home every day drained and tired and hating your job, that's something to think about. But yeah, I ended up getting actually a promotion in downtown LA, working with the reentry population, so folks coming out of county jail. I did that for about a year before the program expanded, and I became the manager of one of the expansions. And I did that for about a year, and then I got licensed in March of 2021. So I think Dr. Court, she was going over the different types of licenses and positions you can get. So I have what's called an LCSW, so I'm a licensed clinical social worker. Which in my opinion, I'm a little biased because that's what I am and that's what I went to school for. But I just enjoy that LCSW, and actually a lot of the, whether it's LMFT, LPCC, clinical psychologist, PsyD, it's just there's so many things you can do. It's not like you're in a box and you can only do one thing. If you just do a quick search, like what LCSW jobs and the LMFT jobs, you'll get jobs in hospitals, jails, schools. Now with the pandemic, like it made so many remote opportunities possible. So you'll see on Indeed, you'll see like a remote company that's going to pay you $90 an hour to just do therapy straight from your house. If I'm being transparent with you all, my fiance is a consultant for Providence Hospital. She's also an LCSW, and she is consulting in the other room with a ER doctor from Oregon. So it's super broad. You can do so many things with it. And yeah, I kind of decided that I was a little tired talking to people and hearing problems all day, which is why I kind of wanted to go more towards management and, program design, implementation. And yeah, and my supervisor last year, she had kind of felt like she was ready for something else and had a conversation with me, like, how would you like to take my job? What do you think? And yeah, and I became a director this past March. So I've been at it for about 6 months, 7 months around there. And it is kind of kicking my ass, but I'm making it work. I'm learning a lot. And just, being kind with myself, with my expectations. And yeah.
Oh, that was amazing. Oh my goodness. I have so many follow-up questions, but I'm gonna save them till the end.
Yeah, sorry, I didn't mean to go off on a tangent. I'm sorry about that.
No, that was wonderful. I mean, I love, like, I'm sure other folks would echo this, but I love the combination of the professional and the personal, and also the strengths-based perspective, not just in your work, but also towards yourself. Like, I love that having the time to celebrate and quality of life and those sorts of things. So that was wonderful. Thank you so much for sharing.
No problem.
So the next question is, oh, and again, this is so sorry, I have something with my PowerPoint today. There we go. And this is kind of like a drilling in, but like, what were your graduate classes like? And for this, it's and maybe not just like the subject matter area, but like the transition to graduate school too.
I will say yes, that's a great question. It is different. It is different, you guys. I always thought of myself as a decent writer. I usually did pretty well, in high school in English and during my time at Cal State LA. Grad school, it's just another level. And it's not so much that it's hard, it's just it's a different way of writing. Like you literally can't say good morning without citing a source. And it takes a bit to get used to how to do that, how to write like that. I also realized, just certain strategies that worked for me during undergrad, they just didn't work anymore. I used to be able to stay up late at night and, kind of cram, make it to my class, with 5 minutes to spare and be fine. And there was no way. I tried that my first assignment that was due, and I was just like panicking the rest of the week, like, how am I going to do this? I will also add that it wasn't as many, at least my experience at USC in the MSW program, it was different in the sense that there was only really 2 assignments. It was a midterm and a final. And that could have been a paper, that could have been a presentation, that could have been some sort of research we were doing with a topic of our choice. But it was different, with some of my classes at Cal State LA, and even, that year I took at ELAC, I remember, like I had like a weekly assignment due or a weekly, quiz due, or just something that was always consistently being turned in or submitted. And at SCA was like, hey dude, like you get 45% of your grade midterm, 45% final, and 10% for attendance. So that was a little different. So I think you as a student, you kind of have to make sure you're on your toes in terms of your self-accountability, because it could be super easy to kind of just fall behind because you don't have that, continuous thing due. And anything else in terms of the class? Any questions about the classes, you guys? No? Okay. I will say go to a school with a great sports program. I will say that. Go to a school with a great sports program so you guys can go to the games and all that fun stuff.
Yeah, definitely the good tickets are nice.
Yes.
So the next question, if it's gonna go, there we go. Sorry, wrong way. There we go. So this might be difficult because it sounds like you recently transitioned from kind of working in the field to working in the office to working in management role. What's a typical day like for you?
Yeah, it has, especially given COVID as well. COVID just changed the way we as an agency as a whole operated. Granted, the programs I've always been in have always been frontline programs. So when I was the manager and my team of the ODR team, the reentry team, we took maybe like 2 weeks off of not seeing people in person. And then after that, we're right back out there, 6 feet distance, mask. At one point, one of my case managers came to work looking like a dentist. He had the face shield, the gown, the gloves, everything ready to go. But yeah, these days, my work does look a little different. For example, my Wednesdays in particular, I'm in meetings from 8 a.m. to 4:30 p.m. like just back to back to back. It's a little brutal, but as soon as I find another manager for one of my teams, I'll be all right. So yeah, I'm primarily in meetings, behind the scenes kind of work, about the budgets, numbers, program design, and evaluation. So how how can we do things different or better, more efficient? Giving my managers who oversee their teams, giving them the tools they need to be successful. Okay, I do have what's called an LPS designation, which stands for Landsherman Pletcher short. So if anyone is presenting as a danger to themselves or others or gravely disabled, I do have the authority to put them on a 5150 hold. And I know I'm throwing a whole lot of jargony words at you guys, but you guys can just Google, 5150 LPS. So if one of my staff members is out in the field and is like, hey, I think so and so needs to go to the hospital, they'll call me out to go and kind of assess the situation and the person to see if they meet that criteria by the county to be sent to a hospital, essentially against their will. It's not something that I enjoy doing, but at the end of the day, it is to benefit the patient in the long run, patient, client, to help them restabilize on medication, or just if they're using drugs to get that out of their system. Yeah, I try not to answer my phone when I get those calls. Just joking. And yeah, and a lot of my time, when I'm not like in a meeting itself, is providing what's called supervision to my staff. So we usually meet an hour a week with my managers, just to kind of see how they're doing, how their people are doing, how their staff is doing. Like what is it that they're seeing, on the ground that we can potentially be doing better. And I actually recently hired a manager about 2 months ago to take my old job. And I just hired a manager. I promoted I promoted somebody to take another job that I was covering. So my supervision time, it went from 13 hours a week of just talking to people directly to 4, which I'm so grateful about, because it's a lot. It gets pretty draining by your Thursday.
Yeah, delegating those things is feels pretty good.
And of the 5 programs I oversee, 4 of them now have a manager. So, in one of my mental health programs, I'm acting as their manager, so that one I'm a little more involved in, running their team meetings, being available for their supervisions, going out. There was this event at these apartments called Chesterfield Apartments over on Normandy, and I think 48th, a couple weeks ago, where the mayor Garcetti was there. So I was there to support my staff and the agency. It was pretty nice. And actually, I have this link open. I can put it in the chat just so you guys can get some more info about one of the programs that I oversee. And the 2 clients that they actually that they profile are 2 alumni from our program. So I think that's pretty cool. But yeah, you guys can check that out at at your own time.
Awesome, thank you. And I love that within your experience, you have not only had like the direct treatment aspect, but then also like the programmatic aspect to move from like individual level to interpersonal level or community level interventions. And that's really awesome too. So what are some challenges associated with this career?
Challenges, how much time do you guys got? No, I'm just messing around. I'll be straightforward and transparent with you all. I think social services as a whole, it doesn't matter if you're going for your LCSW, LMFT, LPC, like working with people in social services, it's definitely a field where you kind of need to put the work in before you start really making a good living. Like I think Dr. Court hit on, like even just your internship, you're working essentially for free for 2 years. And then once you just graduate, you have your master's level degree, like, yeah, you'll be able to get a job. You'll have no problem finding a job, but more than likely, like that dream job that you want, you're gonna have to work a little bit and gain some experience before you get it. Not saying that it's not possible, because it definitely is, but it does take time. I think she kind of talked about hours. It took me about 2.5, 3 years. Yeah, 2.5 to 3 years to get my hours, to accrue all my hours. And then, just the process of dealing with the state and getting a test date and all that, like, can take like another 6-7 months, depending on what's going on at the state level. So yeah, it is somewhere, where you have to put in the time, but the money is there. Believe me when I tell you, the money is there. Just go on Indeed and type in, LCSW, LNFT jobs, and you'll see some numbers where you're like, wow, I can earn that with that degree. Like, it's there. You just have to find it. I will also say burnout. Not sure how many of you all had heard this term before. But burnout, just to put it in the most simplest terms, is when you get to the point where you just hate your job. It's just you hate coming to work, you hate when your phone rings, nothing's bringing you happiness, you don't even know why you're still there. And I know it sounds like a pretty tough place to be, and that's because it is. And I think, and I've personally seen, colleagues of mine and just throughout my time here, who have experienced that. I'm fortunate enough that I feel like, I was trained well enough and have support, around me to kind of, hey, I think you might need some time off. And, that I work at an agency where they value that, where they value self-care. But yeah, burnout, I would say that's so real, because, you can go to an agency where they're like, all right, you guys, out of the 8 hours you're working, I need you to be talking to people for 7 hours, and then do all your notes are due by tomorrow. And, sure, like maybe the first day, first week or two, it's manageable, but after, 6 months, you're just like, oh man, I got to get out of here. So that's why making sure that you're taking care of yourself, that you're not losing sight of what it is that makes you happy outside of work. Like, those are the kind of things that are going to keep you going and keep you, from burning out. Because I've had colleagues of mine who, once they hit that point, they just change career fields entirely. Like, you know what, I don't want to do this anymore. I don't want to ever feel like this again. I'm gonna, go out and, I don't know, become a nurse or whatever it may be, which is totally fine. But yeah, it can get to that point. So I think having that self-awareness and that support system around you guys to make sure it doesn't happen. Or if it's starting to, that you address it, whether it's taking some time off from work, going to get that pedicure you might be thinking about. Even something as simple, one of the things that I learned was just something as simple as turning off the ringer of your cell phone. So you can get that good night's sleep, or you can even just take that little nap without being disturbed. I'm a napper, I'm a big napper, so naps help me get through the day. So, as a parent of a 3-year-old, it was pretty hard to adjust to not being able to nap anymore.
There's a lot of research about the importance of napping, so it's an empirically validated practice.
Yes, and I think that was I think I would say just, like that, the pay, like, getting to a place where you're making, a wage that that you feel is good for you, and the burnout. I think those would be like the two biggest challenges that I've encountered and that I kind of see in the field.
Awesome, thank you so much. And this next question is kind of the flip side of that. So wait for it to load, because I'm gonna hit it twice and then it's gonna go forward twice. The next question is, what are the good parts about your job? What are the things that are nice about the field? There we go. The rewarding aspects of the career.
Yeah, and it might be a little cheesy, but just helping the most vulnerable. I think deep down, like I am a helper. So just being able to see what that looks like, both on a micro and macro level is what has kept me fulfilled. And if any of you had a chance to look at the article I sent, just seeing when I met both of these, folks, I met them inside the Twin Towers jail and inside the Century Detentional Regional Facility in Linwood, so the women's jail. You know, to see them, to meet them and kind of give them the like outlook of the program and have them sign paperwork inside jail to having their own profile, and they have their own apartment now. Like that's amazing. It leaves me speechless just thinking about it, because I know how many times I had to hospitalize both of them. But with that being said, yeah, I think it's also in a field like, you know, social work, therapy, working with vulnerable folks, is learning how to take the small victories as well. You know, both for like your work with people and also for yourself. You know, because usually, like in my world, I saw that statistic of Dr. Court highlighted about, like, you know, just the percentage of mental illness, and schizophrenia was like, you know, pretty down low. It's pretty rare, you know, in comparison to like depression, anxiety. Schizophrenia is all I see. Schizophrenia is all I see. And, you know, with folks with that diagnosis, it's just so severe and debilitating that you don't, you know, it takes a long time before you see any positive change, if you're ever going to see it. You know, so being able to like just having a client, you know, who is never on time, show up on time, you know, or for yourself as a therapist, you know, maybe you get intimidated, or, you know, with clients that keep talking and talking, like you don't want to be rude and, you know, cut them off and respect your own time. And maybe, you know, through some of your work, you learn to gently hold that boundary of keeping the session under 20 minutes. You know, so I feel like now in the role I'm at, I get to kind of empower my staff to do that. Which has been, you know, a different kind of fulfilling. You know, I'm still helping, still supporting, it's just in a slightly different capacity. And I will also, just one last thing about this is, you know, one of the programs I oversee is providing mental health services in what's called project-based housing. You guys are probably seeing these buildings going up all over the city. These are brand new constructions. You guys can Google The Point on Vermont, and like I get to see, you know, like these buildings from when they're just plots of land to fully functioning apartments with formerly homeless people living in them and receiving mental health services and case management. So that to me, that's pretty cool. It's pretty cool when I get to do that.
That's awesome. So just to highlight some of the things that you said, so I was taking notes, but like you talked about the importance of like really good training, having strong support systems, having a life outside of work and kind of keeping track of that. Having self-awareness, especially around when paying attention to what your body needs and is telling you, having rest, celebrating small victories, setting gentle boundaries, and self-empowerment. So those are, I think, I just wanted to kind of highlight those for everybody, because that was, I think, a really good list of things for everybody to cultivate. So thank you so much for sharing that. And oh my goodness, okay, there we go. So just in the interest of time, so we give some time for folks to ask questions that they might have. But what advice do you have for current students?
What advice do I have for current students? I will say, don't be afraid to ask questions. I remember I would never go to the the office hours. I would never, I would maybe see something on like the little pin board outside, a professor's office and be like, oh, that looks pretty cool, but I don't know, I got other things to do. I would say, please ask questions. There's no such thing as a dumb question. And to find mentorship, whether it's, someone, a professor at Cal State LA or someone that's in the field. I think, like I mentioned before, like it just gives you a more realistic sense of what this is. You know, sure, you can read something in a brochure for grad school, but when you talk to somebody, you know, that's done the program, either there or somewhere else, like they can give you a realistic sense of like, hey, dude, like this is how much of a commitment this is going to be. This is, you know, what you might encounter there. This is what you might not get here. So yeah, I would just say, just be curious, you guys, be curious, ask questions, go to, you know, these, what's it called? Like whenever they have like these workshops, or you get an email about like an information session for the MSW program, I don't know, at Cal State LA, you know, just go on Zoom and check it out. You know, you might get some valuable information, and it might not click the next day, but maybe, you know, when you're getting closer to graduation, you'll be like, hey, I remember that information session I was in, and there was like a link to the website and the application and all of that. So I would say just be on the look, you know, be on the look for what's out there for you guys.
Great. Thank you so much. Do you have a few more minutes for questions?
Yeah, sure.
Great. Okay. What questions do we have? You can go ahead and put them in the chat, or if you want to raise your hand and ask them out loud, feel free to do that too. It looks like we have a question already from Diana. Would you recommend going to a CSU instead of a private university for financial reasons?
Good question, Diana. And this is my personal opinion. You know, for every opinion like mine, you'll have 5 people who have a valid opposite opinion. And it really comes down to your personal choice of how comfortable you feel. I think, I'll put it this way. I've met people that went to Cal State LA, Cal State Long Beach, Cal State Northridge, Cal State Fullerton, that are really sharp, that are amazing. And I met colleagues at USC where I'm like, I don't even know how you got into this school. I think at that level, at that graduate level, I think the training is, I think it's similar. I don't think there's that much of a degree of training that's different. And it also depends on what you make of it while you're there. Like I said, I met folks that got their MSWs at Cal State LA, and I'm just like, damn, like you know your stuff. You're really good. Like I can learn from you. And they also don't have nearly as much debt as I do. So that was just something, like I said, I wanted to go to USC. I wanted to, you know, to have that experience going to a 4-year university. Like a USC, because I was a big sports guy, so I wanted to go to a school with a big sports program and do that. And I knew, you know, I was fully aware of the risk with the loans and all that. And in my head, I'm like, I'm just gonna do the 10-year loan forgiveness program, and it'll eventually be gone. So yeah, student loan forgiveness, please do your research on that, because you got to get locked in before the politicians cancel it. But yeah, I think it's personal preference, and it really just, you know, you could be enamored by the USC name, by, you know, everything behind that, and then do a visit at Cal State Long Beach and be like, hey, like I really like this place a lot better. And I will also say that from folks that I've talked to that graduated from smaller programs, they had more of an individualized experience. You know, because the program at USC is very large. I think it's like the largest on the West Coast, and it's online and in person. So, you know, there's like a lot of people in classes. And one of my really good friends, she graduated from Cal State Long Beach, and, you know, she said her professors were always available whenever she needed that additional time to meet with them. You know, they got there, it was like 15 people per class when she got to her upper level classes. And I was like, wow, like I was always in like really large classes where I didn't really have that individualized, you know, time with the professor. So I think that's something you can definitely get at a smaller school. No problem.
Awesome. Thank you. Any other questions? You can go ahead and put it in the chat, or just raise your hand and we can. So I have a question. And this is what I was going to ask you earlier. So advice would you give for folks who like know that mentorship is important and want a mentor and want somebody to connect with in that, professional way, but don't know how to go about that or feel intimidated by trying to find somebody or trying to connect?
Yeah, well, I think attending things like this is definitely a great starting point, and I can share my email, my contact information with you guys in the chat. I'm always available to field any questions or just point you in the right direction. I've done this about 2 times before, and I've had a couple people reach out, just like, hey, what do you think about this, or what would you, if you were in this position, what would you do? So always open to having that, and I personally enjoy, helping students at Cal State LA since I went there and I know what it's like to be in that chair you're in. And I think there's also like I think there's like some sort of like Cal State LA alumni like mentoring website as well. I haven't checked it in a while. I remember I signed up a long time ago. I haven't checked it, but there is that, where you can connect with people in the field. And once again, like, when you guys are in passing on campus and you see those flyers for like, so-and-so from Children's Hospital is going to come speak, in Simpson Tower, like go get a business card. You'll never know when you're going to need that business card.
Awesome, thank you. Any other questions? Well, that was amazing. Oh my gosh, thank you so much for coming to share, Caesar, and for all of your wonderful insights, and also like good luck and all of the things that you're doing. Oh my gosh, it sounds like you're doing so many things.
No problem, you guys. And I just put my email and my cell phone in the chat. And if you do just a quick search of my name on LinkedIn, you can definitely connect with me there as well.
Awesome. Thank
Yeah.
you.
Thank you for the opportunity, Dr. Munger. I really appreciate it. And good luck, you guys. You guys got this.
Thank you so much. For the folks who are I want to hang out for just one more second. The only thing is that I wanted to go over is just stuff that you can do to prepare for your like if you're interested in mental health fields. And I'm going to send out the slides to everybody that registered. But there are classes that you can take that can help you get prepared for whenever you make that next step to graduate school or to get you more familiar with the content areas. And then there's also on this slide some additional websites for certificates and programs that are relevant to the field too. And then if you are interested in enrolling in courses, or if you have further questions, you can email me if you want, or you can email Dr. Dennis, who's the department chair, and like I said, that'll be on the slide. And then if you don't mind taking the survey that oh goodness gracious, a survey. So what we're trying to do with these workshops is to help everybody get some more information about different types of careers, get everybody exposed to different pathways, get everybody connected with alumni and folks who graduated and then not too distant past who are already kind of off and going on their own journeys. And so what we want to do is make sure that these workshops are helpful and that things are useful. So if you wouldn't mind filling out the survey link that is in the chat, that would help us a lot to kind of better tailor and target our programming too. But thank you all so much for coming. And we're going to end here. If anyone has any questions and wants to sit tight and ask me anything, I will be right here for a few more minutes. And otherwise, good night and have a good couple of midterms and everything else that's going on too. Take care.